Hello, my name is Jeff Johnson. I'm co-president of PSARA, Puget Sound Advocates for Retirement Action. PSARA is a multi-generational organization working on retirement security, racial, social, and climate justice issues. Today, I want to talk to you a little bit about Medicare, in particular, a little bit about its history, the threat that privatized Medicare poses to the system, as well as ways to strengthen traditional Medicare. In 1965, the Medicare statute was passed. Prior to that, nearly half of seniors and the disabled in the United States had no health care whatsoever. This, of course, posed a huge health care risk for our seniors and led to millions of premature deaths. In 1965, with the passage of Medicare, traditional Medicare was created. That allowed a beneficiary to go see a doctor, their attending physician, and the decisions that they made together were what held true. If the doctor prescribed you're seeing a specialist, then you could go see a specialist. You could see any doctor anywhere in the country where Medicare payments were accepted. However, to get the bill passed in 1965, a grand bargain was struck between President Johnson and Senate Democrats, particularly from the South. This required that not all Medicare payments would be covered by the Medicare Insurance Fund. Instead, 20% of doctor's visits and specialist visits would be on individuals' dime. In other words, if you wanted to afford Medicare healthcare coverage, you were going to have to buy a supplemental insurance plan or a Medigap plan. For all intents and purposes, this meant that some African Americans and some people of color still could not afford Medicare healthcare as seniors. This was inequitable then, and it remains inequitable today. Overall, though, traditional Medicare has improved the health and the quality of life of tens of millions of seniors over the decades, and it has saved many, many, many lives. Today, however, traditional Medicare is under threat from privatized Medicare. 20 years ago, Congress passed a statute allowing private insurance companies to manage Medicare claims. These are called Medicare Advantage plans. President Trump extended that to all private industries through a pilot program called direct contracting. This allowed companies like Amazon to purchase traditional medical companies like One Medical that did administer Medicare claims. President Biden, through the Centers for Medicare and Medicare Services, has rebranded that pilot program, calling it ACO REACH. So just minor tweaks are made. ACO REACH stands for Accountable Care Organizations Realizing Equity and Community Health. These private programs are paid hefty premiums to administer claims. These premiums allow them to have low to no monthly premiums for beneficiaries, allow them to provide some expanded services around vision, dental, and hearing, allows them to pay for advertising. You've probably seen Joe Namath and other B-rated stars advertise Medicare every October through December, kind of the Medicare window for choosing plans. It allows them to pay for insurance brokers to channel people into Medicare Advantage programs rather than traditional Medicare programs. And it also allows them to cap out-of-pocket expenses. These are good things, right? How can they do this? Well, they can do this because they're paid more to do this. They're paid anywhere from 15% to 35% of every Medicare dollar as profits or surplus. They also apply prior authorization. So the decision you and your doctor make isn't the final decision. Instead, there is a manager, an outside manager, third-party manager, that steps in between you and makes the decision on whether you can see a specialist or not. This oftentimes leads to delays in your care and oftentimes denial. It has been well documented that in these Medicare Advantage and ACO REACH programs, that there is rampant overcharging by these private companies for their services. And finally, fraud. It's been well documented by the New York Times, by independent researchers on healthcare in the country, and in a recent study by the Physicians for a National Health Program, that Medicare fraud ranges between $70 billion and $140 billion a year. Now, this leads to significant delays and denials of care for seniors, but as well, it robs billions of dollars out of the Medicare Trust Fund, which then in turn raises the premiums that seniors on traditional Medicare programs have to pay. And it puts an upward pressure on Congress to raise Medicare taxes, which all people who are employed pay. Medicare was not supposed to be like this, nor does it have to be. PSARA has created a campaign to level the playing field between traditional Medicare and the privatized plans. We propose very simply to eliminate the Medigap policies from traditional Medicare. As I mentioned earlier, this 20% payment has its original historical basis in racism. There is no reason for it, and those on Medicare Advantage don't have to pay for it, so neither should those on traditional Medicare. We need to enact out-of-pocket expense caps for traditional Medicare beneficiaries. We need to have the same level of extended benefits around hearing, vision, dental, around long-term care, around transportation. We also need to eliminate the fraud and overcharging in the privatized system. If we set traditional Medicare on a level playing field with the privatized programs, we believe that seniors will be faced with a real choice. Will they choose traditional Medicare or a privatized Medicare program? I, for one, would choose a traditional Medicare plan. I don't want anyone stepping between decisions my doctor and I make about my health care. That is sacrosanct to me. I don't want anyone interfering with those decisions. Finally, there is absolutely no reason to deny those beneficiaries on traditional Medicare from the same level of benefits that those in the privatized programs get, nor is there any reason for us to pay more. We shouldn't pay the Medigap policies, and we shouldn't have to pay absorbent out-of-pocket expenses. They should be capped. So look, we are under real threat. Last year was the first time in our history where more than half of Medicare beneficiaries are on these privatized programs now. And we've got to stop it. We've got to stop the fraud. We've got to stop the cheating. We have to level the playing field so that seniors can make honest and reasonable decisions about their health care. PSARA wants to see this happen, and we're working in coalition with many, many organizations around the country to do that. If you'd like to learn more, go to our website, PSARA, PSARA.org, and you'll find lots of resources to take a look at. Thank you very much, and let's strengthen Medicare for all.